Headaches are really annoying, especially when they include tension and include migraines. And how do you prevent this sort of thing from interrupting your life? Well, Dr. Snowden is here to tell us how to do that. So Dr. Snowden, this is something that happens to everybody at some point, having an annoying tension headache. How do they start?
There's so many different ways. Stress, of course, is a major factor in tension headaches. Tension headaches in particular are headaches that emanate from the neck or the muscles around the neck, and they usually start in here and they go all the way up to the head. They can be debilitating, and depending on your lifestyle, on your posture, on a lot of different factors, more people are going to be affected by them more than others.
Well, so what are some factors that sort of increase our likelihood to get these? I think diet might be one of those.
Well, diet is going to be more indicated in migraines, but in tension headaches, posture. Posture. When you look at somebody from the side, exactly, and you start seeing the hunching over in the anterior head carriage, that's going to really stress the muscles of the neck. If the muscles of the neck are already stressed, then they're already increased in tone, already tight, and when you're stressed, they're going to go into spasm. That spasm is going to cause inflammation of the tissue in that area, but also it's going to cause activation of the pain sensors. And then that's what causes a tension headache.
We start feeling the throbbing headaches. And then with a migraine, our diet can play a factor then.
Oh, a huge factor. See, migraines are very often misdiagnosed. Very often, 80% of sinus headaches aren't really sinus headaches. If you don't have a bacterial infection, 80% of the time in studies, sinus headaches are really migraine headaches. And that's a whole different thing. 70% of the sufferers of migraine headaches are ladies.
Oh, wow. So does that have to do with our hormones?
Exactly.
Okay.
With estrogen. We find that low estrogen or high estrogen levels are indicated in migraine headaches the majority of the time.
Wow.
So ladies have migraines mostly premenstrual and postmenstrual. And very often during pregnancy, they disappear altogether.
How interesting. I didn't know that. Well, what are some triggers of stress? I mean, I know a lot of us sit at a computer all day and we're hunched over, and there's just stressful situations. You think that those really are triggers for these kinds of headaches, migraines, and tension headaches?
Sure. And how your body deals with stress. It's been seen that high estrogen levels decreases your ability to deal with stress.
Oh, wow.
But also low estrogen levels also cause migraine headaches. And in today's society, where so many ladies like yourself are fit, and watching what you eat and trying to avoid fats, that in diets that are less than 18% fat, you tend to have low estrogen levels.
Gotcha.
And that in itself, keep in mind that cholesterol is a type of fat. Cholesterol is needed to make estrogen. If you don't have enough cholesterol in your system, then you can't make enough estrogen. There again, you end up having migraines and other problems.
Wow. Well, and what about medication use? Does that affect the way that we feel and how we get these headaches and get migraines?
Sure it does. In two different ways. You have over-the-counter pain meds. The worst thing you want to do is use over-the-counter pain medications to moderate or to treat your headaches, because there's a rebound effect. And what the rebound effect does, in essence, is when you use a medication to cause one response in the body, your body overly compensates and does the exact opposite. And so very, very often people who use over-the-counter medications to mediate their headaches end up with even worse headaches.
So I shouldn't keep taking 6 ibuprofen every time I get a headache, is that what you're saying?
No, you really shouldn't. Also, headaches can be an indication of more severe things, meningitis and many other illnesses. So when you're getting headaches, don't self-diagnose.
Well, what are some foods that we should avoid if we want to avoid getting headaches?
Only the good ones.
Gotcha.
Right?
It's all the sugar in it.
No, it's aged cheese, it's red wines, it's soy.
Really?
You see, it's miso soup. It's anything that's pickled, that's salted, that can last in a refrigerator more than a couple days.
Okay.
Those all have a chemical in it that helps cause migraines.
Okay, what about chocolate, Dr. Snowden?
Of course, chocolate. Of course, chocolate.
Anything good, right?
Chocolate, anything with caffeine in it.
Okay.
Also helps to increase migraine headaches.
Wonderful. Well, these are great tips, and I will avoid all the chocolate, the caffeine, the red wine, the aged cheese, because I don't want any more headaches.
Well, see, it's not, you don't want to just not have have an eventful life.
Right.
You know, one, you want to go to an expert who understands headaches. Make sure you know what type of headaches that you have. There's so many different types of headaches and so many different causes.
Well, thank you for breaking it down for us. I really appreciate it. And if you would like more information about this holistic method of treating pain, you can contact Dr. Snowden with Sharp Pain Management and DFW Health and Wellness. And his website is dfwhealthandwellness.com, or you can call 214-872-3391.